This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. And by Lee Health.
Southwest Florida, welcome to another edition of Lee Pitts Live. And where in the world is Lee Pitts Live right now? You will never guess this. Okay, I'm going to go ahead and give you the answer. We're at the Florida Department of Health in Charlotte County. We're so thrilled to be here. It's been a dream in the making. I've always wanted to get out here and certainly wanted to get a chance to talk to my good friend, Dr. Joe Pepe, who's an administrator for this health department, interim administrator, and we'll find out all the other things that he's involved in with the health department. Also, we get a chance to talk to the executive director of Art Fest Fort Myers, Sharon McAllister is here as well. All that's happening on Lee Pitts Live, get on the phone, text somebody, tweet somebody, Facebook somebody, email somebody, but do something to somebody to tell them to tune in to Lee Pitts Live right now. Southwest Florida, welcome back to Lee Pitts Live. We're so thrilled to have as our first guest this morning on the show, the incomparable, the undescribable Dr. Joe Pepe. Joe, welcome to the show, man.
Thank you for having me.
It's been a minute since I last had you on the show, and my ratings went down, so with you on the show, they should go back up.
Thanks for having me. It's great to be here.
Say hello to the wife for me.
Yeah, no, it's great. Say hello to everybody, all of our community, and our employees of Charlotte County. They're a great team. And
you're here as the interim administrator.
Right.
So you have dual responsibilities right now, right?
Right. Currently, I'm the official administrator or health officer for Hendry and Glades County, and I've been covering Charlotte County since about May of last year. And it's been a great opportunity. We're doing a lot of great things here.
Well, they got the right man for the job. Tell our television audience where we are physically located. We're in the conference room at the Charlotte County Health Department.
Right. We're in the health department located on Loveland Boulevard in Port Charlotte. And we do some community outreach locations out in Inglewood area, but this is our primary location.
What physically happens here? I see a lot of, when I pulled up, I was so surprised. The accommodations have just been outstanding. It's like a lot of activity takes place here in Charlotte County.
Yeah, this is a one-stop shop location. We have human services, which you'll hear a lot more about. And then we also have here is the health department. We have our clinic site. We have a dental program. We have some other clinical services, our environmental health department. We have our epidemiologists here. We have a lot of folks here that provide services to our community.
Yeah, before I get to some other key things, in my conversation with you off camera a while back, I found that to be quite fascinating. I shared it with some friends. You say, Lee, when disasters happen throughout the state of Florida, they mobilize all of us from different places to go there.
Right.
You were like, I think you were up in Tallahassee, Pensacola.
I was in Panama City for the last hurricane, helping recover and running the shelter up there, helping coordinate efforts, bringing the hospitals back online. We're an integrated system, so all 67 counties work together. That's
outstanding. We're fortunate to have that type of coverage for our state that has a lot of natural disasters. So in a nutshell, how would you describe the Charlotte County Health Department?
So I think succinctly to say it is the health department really focuses on keeping people healthy. I think if we do our job really well, folks can live their best lives. We protect people from natural disasters and outbreaks and things like that, but we also have programs to help people prevent diseases through immunizations and other things, and then lots of health education as well.
When I first pulled in this particular place, I said, hey, it looks like a hospital, but it's not a hospital, of course. That leads me to my question. How is public health different from primary care?
Right. We're the friendliest clinic you've ever been to. I have to say that for public health, really what we're focusing on is keeping people from ever getting sick in the first place. It's population health, keeping folks to avoid certain diseases, measles, for example, chicken pox, things like that that can be vaccinated. We have other programs that get into outreach for new moms. We do programs like breastfeeding initiatives, car seat initiatives, where we actually distribute car seats, educate on how to install the car seat safely, injury prevention, all kinds of other things, again, to keep you living a long, healthy life.
If one goes to your website, which we see on the screen, there's a lot of information there. I was over there on your website like maybe two or three weeks ago.
Right.
I was like, man, I'm learning more just here. You try to show a wide variety of information, and you show people departments that they can go to.
Right. And so we're really, we try to be a one-stop shop. If somebody just calls the main number or goes to our website and inquires for more information, somebody will reach back out to them and get them the information they need, link them to different services in our community.
Here in Charlotte County, vis-a-vis Henry Glades, what are some specific differences in terms of health needs, or are they very similar?
You know, it's very different. Henry Glades is a very rural community, but Charlotte County has some rural communities as well. I think the needs from a population perspective on immunization and resiliency from hurricane, natural disasters, things like that is still much needed. Some of the things that we do a little bit more here in Charlotte County that maybe not as much in Henry Glades are in our environmental health programs. We have beach monitoring program and some other things. So where Henry Glades is not a coastal community.
I see. Yeah. What are some of the key programs that you have been working on lately?
So probably one of the biggest things that we've been doing is expanding our dental program, providing services. For me, it's always been near and dear to provide oral health services. We do a dental sealant program in schools right now, where we go in and we provide sealants to our children in school so they can keep their adult molars and be healthier.
Really?
But our dental program expanding into some services that quite honestly in the past weren't there, so we're doing more restorative dentistry rather than just pulling teeth, so that we can keep people's natural teeth as long as possible and keep a healthy smile.
Okay, so this is a government entity per se, right?
Right.
And you got all these different ones throughout the state. By it being a government entity, just listening to you and observing what you do, it sounds like there could be some cost saving for your clients too, in terms of being able to come to the health department and get those basic things done, as opposed to going into the private sector. Yes or no?
Well, I mean, we partner with private sector as much as possible for whatever care that's needed, but we do provide services on a sliding fee scale. And then a lot of our services, for example, our vaccine for children is zero out of pocket typically. There's a small, sometimes administrative fee, but in the big picture, our goal is to protect the community, and we don't want cost of care to be a barrier.
Give me a for example too on like when we have something that's like happening in society more than like it might be an epidemic getting ready to get started. Are we trying to educate people about it? Say like smallpox or mosquito bites or something like that. How does that process start with the health department? You see a trend and then you focus on it, whether it's HIV and things like that?
Right. So there's several things we monitor. We have reportable diseases, where if a patient reports to a hospital or a medical provider and they have symptoms, they do some lab tests, they report to us, and then we immediately work on that. We have several things that we try to do in a preventive fashion. So, example, flu season. So we really push the immunization and hand washing and covering your cough and all of those type of things, and that's really a seasonal discussion that comes around between January and February. We're coming into that season now, and so the challenge that we have is to educate the public to act to protect themselves and really let them know what to be concerned about and how to protect themselves.
I see. Now, getting into the school system, I would think that would be critical and that would be very vital in terms of educating the younger generation going forward and finding out things that might happen in the school system. What's the relationship like for your health department with the local school systems, and what are some things you're doing in those systems?
Well, our school systems are a great partner. You know, it's funny, and we've known each other a long time, and you know, my prior experience has been in education. And when I came to public health, I started to look at the same things that were causing people to not do well academically were also the same factors impacting people's health. And so in the public health, we look at social determinants. And so what we've been working on with our community partners is really creating a protective environment for our kids so that when they come to school, they can thrive. And really looking at things like oral health, what I talked about, vision screening, and some of the research that I've been involved in with adverse childhood experiences and preventing traumatic experiences early on in life have a profound impact on their course. Lots of research supports also that the more education someone receives, the more likely they are to be healthier, as well as they have a higher earning, as well as lower unemployment rates, which are all protective factors.
I'm glad you mentioned that. I'm going to go down that road for a second to humanize this. I grew up very poor by American standards, in poverty.
Yeah.
Didn't go to the dentist until like I was in high school.
Right.
And when we did go to the dentist, it was subsidized with Medicaid, Medicare, whatever the different government that your income allows you to get subsidized on. But my mom could have taken advantage of those things early on, but she wasn't into dental care. So we had to get all types of things done to our teeth, and me being me, we being my siblings and us.
Right.
And now that I'm educated, my son, he gets all of this stuff way in advance. It definitely ties to education and income status and, you know, demographics and different things like that, right?
Right, absolutely. And so, and that's why our outreach to the dental sealant program is so important, as well as with our clinic services, so that cost isn't a barrier, especially for our kids. But for adults as well, we've had adults come in that were in crisis, that their mouth was hurting so bad, they were missing work, all kinds of things. We've had challenges with adults that are missing their front teeth, and so it's hard for them to get a job because people may judge them by the way they look or their smile.
Exactly.
It impacts their self-confidence. But not just that, we also focus on maternal health. You know, for new moms, a lot of times having a baby is exciting and scary at the same time, so our nurses do a great job in educating, and our WIC team does a great job in helping talk about safe sleep habits and how to bond with your child, and breastfeeding initiatives and nutrition and all those other things that make a huge impact.
Now, you sound like a doctor, a medical doctor, but we want to be clear to people. He sounds like a medical doctor, but the doctor in front of your name represents?
Right. I have a doctorate in education. I am a researcher, not a medical provider.
Okay. Now, let's go to, you mentioned it early on, and I've talked to you about it before. You mentioned your research, and you were very passionate about that. Talk a bit about that research that you've done and some key findings that you got there.
Some of the things, when I first became a health officer, I was asked all the time about helping our workforce be healthier, help us provide a more viable workforce, help us reduce teen violence, help us reduce drug use and different things like that, addiction issues, domestic violence. And so when I was doing my research, I came across a study that was done in the 90s that talked about adverse experiences and the impact that has on the life course. And so one of the things that have been driving our conversation here in Charlotte County and Hendry Glades is how can we create a resilient community, a protective environment, so that when life happens, it's not a catastrophic thing. You can bounce back from it and still continue on and remain healthy, protecting our kids, protecting our adults, and just having those really good conversations and training folks. Just to give you an example, if you've had a significant amount of adverse experiences as a child, up to 50 years later can have profound mental health impacts upon you. Yes.
Will your research continue, or you put a bow on it? Or you
No,
always
absolutely.
Be
this is a
updating it?
continuous conversation. In fact, you're going to hear more about some initiatives we're doing throughout the community that we're bringing all of our partners together to have these conversations. And it covers all types of factors. What might be a traumatic experience to me may not be traumatic to you, but again, going back with the environment idea of, do we address a housing issue? Is it an economic issue? Is it a reemployment issue? Somehow to allow that child to thrive and get off to a good start.
Would that fall under some of the upcoming things you may have?
Yeah, I think that that's exactly the undercurrent of the conversation that we're having with our partners, is how can we create a more resilient community environment that is age-friendly across the lifespan. So we have seniors that may be living alone and be lonely or isolated. We have children that are moving from house to house that we need to stabilize to help them so they can focus on their academics. We really focus on the life course, on intentional injuries and all types of other things. So those are the undercurrent conversations that we're having.
That's outstanding. Well, Joe, it's been a pleasure having you on the show.
It's always great being here.
And we're going to, throughout this month, be profiling some various things that are happening here. And certainly we'll be coming back here in late 2019 or maybe early 2020. How about that?
Absolutely.
All right, as the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by this man who gets my ratings up, Dr. Joe Pepe, and all the fine people here at the Florida Department of Health, Charlotte County, who are doing it. We'll be right back and learn all about Art Fest. Give him a hand. Hi, everybody. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts, the host of Lee Pitts Live. We're here at the Holiday Inn Airport in Fort Myers, and I want you to continue to watch Lee Pitts Live on television, on YouTube, and of course, listen to us on radio. But to get all of your shows to come right to you, Just click on that subscribe button right there, and Lee Pitts Live will come right to you, your time, your way. That's Lee Pitts Live.